My name is Dr. Vibha Dubey. I am consultant pediatrician in SKG Hospital Jodhpur, visiting consultant in IIT Jodhpur and HPCL Pachpadra. Today, I will be giving some tips about height in children. Height is an important part of personality of an individual. Parents who are themselves short in height, they constantly worry about the final height of their kids and they often visit pediatric clinic and consult pediatrician for the same. So in this video, I will share some facts about the height of the individual and some tips to increase the height of a child. Now first of all, let us talk about how to calculate the expected height of the child from parental height and present height of the child. Final height of the child is genetically determined. An approximate adult height of a child can be determined by first calculating the mid-parental height. What is mid-parental height? Mid-parental height in boys will be calculated by mother's height in centimeter plus father's height in centimeter divided by 2 plus 6.5 centimeter. Mid-parental height in girls will be mother's height in centimeter plus father's height in centimeter divided by 2 minus 6.5 centimeter, and target height range should be mid-parental height plus minus 10 centimeter. This is the target height that will be expected in a child. Now coming to how much gain in height should be expected before puberty and after puberty. The growth of the height is maximum when the baby is in mother's womb. So proper diet of the mother and proper health checkup is very important. The younger the baby, the higher is the growth rate till puberty. Girls hit puberty earlier than boys. After puberty, there is growth spurt under the influence of growth hormone and sex hormone. The end of the bone is called epiphysis, and there is a growth plate between main bone and epiphysis, and this is the reason why there is gain in height. So once the puberty is reached, when there is epiphyseal fusion, that means the bone meets with epiphysis, the growth plate ceases to exist, and that is the time when growth ends in the child. This time is approximately 18 years in girls and 21 years in boys. The growth of the height should be 2 inches per year from the age of 3 years up to puberty. Now coming to what are the factors influencing the height of an individual. Genetics is the most important factor affecting the growth of the child. If parents are tall, the child will also be tall generally. So 60 to 80% height is determined by parental height. Constitutional delay in growth. Certain children, they achieve puberty late. So the growth spurt starts late, but the final height achieved is normal in all children. Diet is another factor influencing height. Even if the parental height is good, but child is not getting proper nutrition, the height will be less. So the diet of the child should be very balanced in carbohydrate, protein, fats, and micronutrient. Antenatal period. Proper diet and proper checkup of the mother during antenatal period is very important for the proper growth of child. If the baby develops intrauterine growth retardation, some baby catch up in the first 2 years of the life, others don't. There is important role of micronutrient in increase in height in kids. A study was conducted in which children were divided into two groups. One group was supplemented with zinc, another group was given placebo, and finally height was recorded after 6 months. It was seen that there was significant increase in height in the zinc supplemented group, and it was more successful in the areas which had zinc deficiency overall. And secondly, the deficiency of iron. It is seen that children who have got less iron, they have got less hemoglobin level, and then it leads to stunting of height. Next is exercise. Regular exercise results in increase in growth hormone in children and has result increase in height. Another is yoga. Some yoga poses and pranayam results in increased growth hormone in the child and hence increase in height of the child. Sleep. Minimum sleep of 7 to 8 hours is essential for good release of growth hormone in the child. History of prolonged illness. Certain chronic diseases, especially of the abdomen, like celiac disease, ulcerative colitis, Crohn's disease, chronic heart disease, chronic renal disease may also lead to stunting of height. Certain chromosomal disorders like Turner syndrome, they also may result into stunting. So it is very important for to get your child properly evaluated by a pediatrician if there is stunting. Next is deficiency of growth hormone. Growth hormone is released by a gland called pineal gland in our brain. So if there is deficiency of growth hormone, that results into stunting, although it's a very rare cause. Other hormonal deficiency such as deficiency of thyroid hormone and sex hormone can also result into stunting of the child. Now coming to the management. Growth of the baby starts into the intrauterine period. So proper diet of the mother, proper antenatal checkup of the mother and proper rest of the mother are very important things for increasing the height of the baby. And action should be taken immediately if intrauterine growth retardation is seen. After birth, it is very important to follow pediatric clinic for height, weight and development. All these things are plotted on a growth chart and caregiver should become alert if the growth is below 2 standard deviation of normal. In our country, most important cause of stunting is malnutrition of the child. So it is very important to maintain appropriate weight of the child according to age. Proper nutritional advice should be given right from the birth because in our country it is not the deficiency of food which is most important cause of malnutrition, but proper knowledge how to give food to the baby, that is the most important cause of malnutrition. Focus on the micronutrient deficiency. Supplement zinc to the child if the child is coming from a zinc deficient area and supplement iron if the child is suffering from anemia. Ask about the age of puberty in parents. Children of parents with constitutional delay in puberty will also have delay in puberty and the growth spurt will start late in them. Get your child properly checked for any chronic disorder or chromosomal anomaly in a pediatric clinic. Last but not the least, get your child checked for growth hormone. It is a very rare condition and generally doesn't happen, but if it is there, then regular injections of growth hormone can lead to normal growth in the child. So now I have told you everything about the tips to increase the height in children, and if you like that topic, then kindly like, share and subscribe and press the bell icon. Thank you.